Jess, this public health news briefing was a little more heated than we normally see. County Administrative Officer Ryan Alsop condemning some of the new restrictions that are being put out by the state on the county in order to reopen its economy. Here's what he had to say.
Governor, Kern County joins other counties in demanding that you stop moving the goalposts on us.
County Administrative Officer Ryan Alsop expressing frustration Thursday morning, denouncing some of the obstacles that Kern is facing from the state in order to reopen the economy. Alsop is talking about the state's new tier-based system, and in order for Kern to advance to the red tier, which would allow restaurants, gyms, movie theaters, and places of worship to open indoors with limited capacity, the county would need to have fewer than 7 cases per 100,000 people, as well as fewer than 8% of people testing positive for the virus. Right now, Kern is at 7.8 and 9.9 respectively, but Alsop says this weekend the county was thrown a curveball by the state.
They are artificially adjusting our case rate from 7.8 to 9.2, which puts us further from meeting that next tier.
The state is now penalizing any county that is below the state average for number of testing. Since Kern is below the average, our number has been artificially increased by 1.4 points.
A methodology that they came up with that doesn't really have any scientific basis.
In order to meet the state's testing average, Kern Public Health says the county would need to perform an additional 877 tests on average per day. Alsop saying the county has ample testing, so arbitrarily assigning penalties does not make sense.
We don't know what it is intended to achieve, other than to keep our economy locked down the way it is for a longer period of time and to keep parents out of work and their children out of the classroom longer.
Now, the California Department of Public Health did send us a statement right before broadcast here. It reads, in part, the updated adjustment methodology takes into account both low and high testing volume. For the initial tier assignments, adjustments were only made for higher test volume. Ensuring adequate testing volume remains critical to case identification and interruption of disease transmission, particularly in communities with high test positivity. CDPH made the decision to update the adjustment scale to better reflect variations in case rates relevant to testing volume across counties and refine this after local health department feedback. Now, it's also important to mention that during today's Kern County Public Health press conference, they said that the amount of COVID cases in Kern County are still going down as of late. However, they did announce 10 more new deaths. But for now, here outside Kern County Public Health, Austin Westfall, 23 ABC, connecting you.